This is DrHwd, and today we're going to learn about what MSRA is, which is Multi-Speciality Recruitment Assessment. It is actually an exam which helps you to get into the core training for GP, psychiatry, obstetrics and gynae, emergency medicine, neurosurgery, clinical radiology, ophthalmology, anesthetists, and core surgical training. Now, a lot of you would ask the question, how to or what? But before we go to how to, we need to know what. Because, there are 6 questions you need to ask yourself when you're dealing with anything. So the first question is, what is MSRA? It's an exam, as said earlier, to help with these. But what it is exactly? So there is going to be a 2.5-hour exam, or if we break it down, 170 minutes of this exam, where it'll be focused on how you are best suited to get into these trainings in these particular professionalities, right? How you get into these particular professionalities. Now, as I said, it's a 2.5-hour exam. So how is it divided? What are they going to ask? We're going to talk about that. The first part of this exam is something that not all IMGs are taught about, and that is professional dilemma. That is, these are the things that you'd be asked. Forgive my incorrections in the spelling, but yeah, these are the questions that a person who is going to be a junior doctor in the NHS has to deal with, right? And we all are clinically okay, which is the second part of the MSRA, but we're not really okay in professional dilemma. We don't really know how to deal with certain professional situations, or as it was called, situational judgment tests. So how do you deal with this? What do you know about if things are wrong? Whom to approach? Who is in line of authority? What things to do right? What things to do wrong in particular scenarios? That's what a professional dilemma. And the other part of it is clinical. So you know that you have to answer questions with regards to what investigation you need to do, what diagnosis is the particular STEM making, what is the emergency in that particular scenario, or how would you know this is a high risk case, how to escalate it, what things to do, and then about the medication, prescribing, and the non-medication, which is management in a particular scenario for a particular patient. First, let's talk about professional dilemma part of this exam. So as I said, it's a 2.5-hour exam. From there are going to be 95 minutes, and this is going to be the first part of your MSRA exam on the day of your exam, which would deal with the professional dilemma paper. It'll be 95 minutes paper, and you would be given 50 questions. 50 questions, out of which, I guess, 8 questions are palette questions, and those palette questions are the ones where you won't get marks awarded for, but they'll just be there, but you wouldn't know which ones are the palette questions. The similar thing that happened in PLAB as well when you did your PLAB 1. So 50 questions, you have 95 minutes. That means you have 1.5 minutes per each question, but I'd say tone it down to, let's say, 90 seconds, just say 70 seconds per question is what I'd say when you're preparing for it. But we talk about it when we start preparing for this exam together. Okay, so what would be the things that'll be asked in the professional dilemma questions, right? So they would try and ask questions regarding how would you maintain your professional integrity. Meaning, how do you deal with something professionally, right? Some questions and some things where they'll ask you that certain consultants doing something, certain nurses doing something, or you're doing something, and how would you deal with that particular situation? The next kind of scenarios would be focusing on coping with pressure. So like you're doing a job, you're an F1 or an F2, or you are a trainee, and something's come up, you were dealing with emergency, and now another kind of relatively less or more important emergencies come up. How would you deal with that? The third part of the situational judgment test questions would be how you deal with something, and how would you involve your empathy and sensitivity to that particular scenario. So, what kind of questions would there be in the professional dilemma? there are going to be questions which would revolve something around this. You would have a question with 5 options in it, right? So they give you a question and they lay out 5 steps or 5 options, and you have to start from the first thing you do, or the most relevant thing, or the most appropriate thing you do in the particular dilemma, in that particular situation, and then how you go from the most appropriate to the least appropriate. For example, you know, we can talk about somebody being late to work. Would you just directly go and report this latecomer to their clinical supervisor or education supervisor, or would you first want to go and talk to them? So, you know, you have to arrange these particular options from most appropriate to least appropriate. Kind of simple, but it is going to be difficult when you really have a lot of close relating options, right? So we'll talk about it as well. The next thing is where you would have a whole question, and then you would be given 5 or 6 or 7 options, out of which you have to choose the 3 most correct options, meaning you don't have to lay down how or which is the most important or the first step of something, but you have to say which of the following 5 are the most correct ways to behave in that particular dilemmatus or situation of dilemma kind of phase. I hope I said that right. Okay. So that's all about your situational judgment or professional dilemma part. The next thing is clinical questions. So as I said, clinical questions, you have 97 questions, and you have to do those questions in 75 minutes. So that boils down to around roughly 1.5 hours as before, but the thing here is that those 75 minutes are for 97 questions, and as compared to 50 questions in 95 minutes for the professional dilemma. So 97 questions in 75 minutes, right? That seems like you have to be very quick. So I boiled it down to divide in 97 by 75 is 1.2 minutes per question, but I would say that you give it roughly 55 seconds if you're starting, but then you have to be very, very quick, right? So there are 2 types of questions that would be in the clinical side of this exam. The type of questions are extended medical matching questions, and MCQs. You know about MCQs, so I'm not going to talk about that. Extended matching questions meaning that there are going to be many questions and many options for the one question. So when we start preparing for it, you know how it is. So this is how the exam structure is and what you have to be aware of, what to expect in this particular MSRA exam. And just know that this is not a pass or fail exam, right? It's not a pass or fail exam. So for example, when you took PLAB, those people who are IMGs already know that, you know, PLAB is also not a pass and fail exam, right? It's not a pass and fail exam. This one is definitely a competitive exam, right? So competitive exam means it depends on how well the other people are doing, and if you're doing as good or better than the ones that are, you know, taking the exam, you would get into, you know, a list from where you would be choosing, you know. So if you're lucky, or if you're hardworking, and if you're smart, you would get into the speciality. The funny thing about this one is that you have to have, as an IMG, either CREST, or if you are a trainee in the UK, you have to have your F1 and F2 competencies signed, right? So CREST form, we'll talk about it some other time, but I'm sure you guys are aware of what CREST form is. This is a certificate for readiness into the entry, readiness to get into training, basically. We'll talk about it, but just know that this is competitive. This is very competitive exam, so you have to make sure that you score well, not only on the clinical, but also on the situational judgment. And I think the most focus that you should have is on the situational judgment part of this exam. The next thing I want to talk about is the sources. So I think that the most important source would be your background. Your background knowledge, your own clinical goodness, you know, your own clinical understanding of things, your own clinical and situational understanding of things. So if you're working in the NHS, you know, for 4 or 5 years, or if you've been working for at least 2 years, you know how certain situations are, how to escalate things, where to report, what to do. And if you're not working in the NHS, then you have to definitely score well on the situational judgment test. Okay, so the resources that a lot of people use are Past Medicine, eMedica, MCQ Banks on examination. The most recommended out of these is Past Medicine. Why is that? Because first of all, it's a cheaper option out of these all. It's around £25, I think, for 3 months. That's not cheap, but still it's cheaper than the rest of them. Past Medicine is the first one. The second one is eMedica. But the most important thing would be NICE guidelines. NICE guidelines. However, why people recommend Past Medicine is because this one has links to MSRA. It's got a nice explanation. The whole idea of any exam is repetition, right? Repetition of knowledge. So this question bank helps in repeating knowledge by presenting the explanation and then making you go through the NICE guidelines if you want to go through. eMedica is the same, but they say it's not the same as MCQ Bank. So first, there are 2 things you need to focus on when you're trying to understand what to retain for the exam. Number 1, you have to repeat the information as much as you can. By that I mean solve as many questions as you can from any of these. Solve as many questions as you can. The second thing you have to do is make sure that you understand the structure, right? So as I said, that the structure was, you know, as we talked about earlier, but the structure that is closely related to the exam is that of MCQ Bank. So we are going to study from Past Medicine first, then we'll do MCQ Bank, and if we have time, we'll do eMedica, right? I hope this one helped. So I'm here. We'll be going through all of this as we go forward for our September attempt and our February attempt, right? If you have any questions, you can always ask, and good luck. See you in the next one.